The Dr. Fazil Show is brought to you by Health Tips Media. The Dr. Fazil Show is intended for health education purposes only and complies with all HIPAA regulations. All of the CDC guidelines for COVID-19 safety were followed while filming this episode of the Dr. Fazil Show.
Hello everybody, welcome to the Dr. Fazil Show. And now, here is Dr. Fazil.
Hello everybody, I'm Dr. Fazil. I'm here today for March 2023 edition of Dr. Fazil TV show. So we know March is the start of the spring, and spring is very common for allergies. So the topic of the discussion today is allergies. Now when we talk about allergies, it's not about allergies about the food or allergies about the medication. It's allergies in general, right? So we get symptoms of allergies which are like runny nose, cough, sinuses, stuff like that. And most of us, one part of our life or the other have suffered through allergies. So the allergies can present with, as I said, most typical symptoms of, are like a runny nose, cough, sneezing, and that's like your upper respiratory tract allergies symptoms. But then we also have other kind of allergies, which are other symptoms of allergies which are not very evident. And that can present with the joint pains, it can present with asthma. See, remember, asthma is also an allergic condition. A lot of people don't know. People think asthma is not allergy. So asthma is an allergic condition. The upper airway reacts to pollens or anything else which can trigger the allergic reaction in the airway. It constricts. It causes shortness of breath and wheezing. And that could be pollens in the air, something we inhale, something we eat, and sometimes even the exercise or cold air. There's an asthma which is induced by doing exercise because you inhale cold air, so that's kind of allergy, right? So it can affect different wide spectrum of our life. So it also can cause non-specific symptoms like fatigue, tiredness. So I remember a patient which I was seeing in my practice. And what was happening was that she was losing weight and having bad allergies, and we couldn't know what was going on, and find out that she has an air conditioner which was leaking freon gas, and she had an insurance company which was actually causing repair on it, but they probably didn't diagnose that there was a leak, and they was fixing it with cheap solutions until the day she found out that she was actually might be allergic to the gas which was leaking, and it has no smell. So she ended up changing the air conditioner unit, and after that her symptoms were totally gone. She started to regain weight and energy and everything else. So as I said, so that the impact of allergies could be wide spectrum. It could affect your daily life, your social life, and even your work life as well. So we have to be vigilant about that. Other kind of allergies are like a skin rash, even a food allergy can present with something like diarrhea. It's certain kind of food which we are allergic to. You eat the food and right away you get like a diarrhea or abdominal pain or cramps. So that could be also linked to the food allergies. So that's like in a nutshell, the symptoms of allergies: shortness of breath, skin rash, runny nose, cough, sometimes even drop in blood pressure. I'm actually, as a matter of fact, I remember a patient. She was so much allergic to so many things that every time she will go to a certain aisle of like a local store, she will pass out. And everybody was trying to find out if she's having a seizure disorder, epilepsy, or anything else, and nobody could find out. Till we figured that out, that she has a history of strong allergies to various things. So when she would walk to that aisle in that store, she will inhale those fumes from those things they were selling, and it was so strong for her that it will drop her blood pressure and she will pass out. And she was obviously a police officer, so it was obviously big deal for that kind of a profession when you go to a certain situation and you just pass out. So once we find out, obviously first thing is avoidance. Avoid, if you can avoid it, that's the quick fix. Avoid anything which will cause allergies. You can eliminate that food, eliminate that situation, eliminate that chemical or whatever that might be. Just like if you're allergic to medication, you don't take that medication, right? The good news is that we can fix it. We can fix it now. There's a new treatment available. We call it immunotherapy. So we check with the skin test, like what a person is allergic to, and based on that, we can actually, after that, we can do, retrain the body by giving them allergy shots over a period of time. Start with the low dose and slowly it goes to the highest dose, so the body doesn't react. So we're retraining the immune system of the body so people can, have a normal life. Now there's a medication too. It's not just the immunotherapy. There are medications available for treatment of allergy as well. For example, antihistamines, Allegra, Zyrtec, those kind of things. There are medications like mast cell stabilizer, like for example, Singulair. That's another medication which we use in a different pathway to prevent allergies. And as a matter of fact, Pepcid, which is used for stomach heartburn, not Nexium or Pepcid. Pepcid is a different kind of medication. So Pepcid can also cause a prevention of allergies. So sometimes we give Pepcid, Singulair, antihistamines. But if there's acute allergies, like really bad allergies, then we have to give steroids. That's a different treatment plan. But if you have extreme allergies and you have a tendency to pass out or go into shock, yeah, you should have an EpiPen with you all the time. So like some people are allergic to bee sting, so they should have EpiPen with them because they can get stung by the bee at any time, or some kind of food allergies like peanuts. And if they happen to eat them by mistake, they can react adversely, and they should have an EpiPen all the time. And everybody should know how to use EpiPen, that's a lifesaver right there.
Now you can catch up with all of our previous shows on all Roku devices. Simply search for the Dr. Fazil Show channel and add it to your home screen. View our videos online by visiting our website at www.drfazilshow.com. Our videos are available on YouTube by searching for The Dr. Fazil Show. And don't forget to subscribe to our channel. The Dr. Fazil Show is available in multiple provider office waiting rooms across Yuma, Arizona. Don't forget to get your copy of Health Tips magazine and read about this interview, currently distributed across Yuma, Arizona.
So those are the few basic principles of allergies. So for immunotherapy, as we said, we check it, what the patient is allergic to, then we train the body over a period of time by giving them low dose allergens, what they're allergic to, and then build up the immunity. And over a period of time, they get used to it. It is used mostly for things which are very common in the air, because the things which are not very common in the air, you can avoid those things. But things which are common in the air, you cannot avoid. You cannot stay in a glass bubble or bubble like that. So that's why it's important for us to be vigilant about allergies. As a patient, as a person, you should also know that if you're not feeling good, it has to be something else. And it could be subtle allergies, which can present with tiredness, weakness, fatigue, and not feeling good, so remember that. It's a lengthy topic, it's a complicated topic, so that's why the basic stuff we can could be handled by your family care doctor, primary care doctor. But if you do have advanced allergies or allergies which are recurrent or not getting better, you should be seen by allergy immunologists or allergy specialists, which are actually formally trained on training allergies. So that's another thing we have to be vigilant about. So that's the nutshell of allergies, right? So allergies can present with, as I said, skin rash, food allergies like diarrhea. It can present with shortness of breath, like asthma. It can present with sinus issues like runny nose, cough, sneezing, generalized symptoms like fatigue, tiredness, joint pains, not feeling good, and it could be due to the things in the air, things in the food, medications, in the soap which we use, the soap to wash our clothes, perfumes which we wear. So when we take the history, we take the detailed history to make sure that we can find the culprit, find the cause, and try to avoid that if we can avoid that. That's the starting point. Then how you treat it, as I said, we can treat with immunotherapy, and or there's certain medications which can be used for symptoms alone. That could be antihistamines like Zyrtec, Allegra. The difference between Zyrtec and Allegra is that Allegra is non-drowsy versus Zyrtec will make you sleepy, or Benadryl will make you sleepy. Singulair is another medication which works in a different pathway as a prescription. It's not over-the-counter. Capsid can also be used for allergies. For extreme allergies, use EpiPen. And you can see in the back drop like how the EpiPen is being used. You inject right in your thigh muscle, and it could be life-saving, especially if you are allergic to a lot of things and have strong allergies. You should be careful about that. So that's the allergies and how it can change your life one way or the other. So if we can diagnose it and fix it, it can make your life better, and you can feel better and can be more functional and more healthier. So that was my brief description about allergies. So ladies and gentlemen, we will be talking more about other topics in the next Dr. Fazil TV show next month. On that note, God bless you, God bless America, and have a nice day. Thank you so much. Dr. Fazil here.